It's Monday morning. We're still in the midst of the pandemic, as you heard during the top of the hour news there with Whitney, and taking time out of his busy day, which is so greatly appreciated, is our friend Dr. Dennis Norem from Mercy Health. Dr. Norem, good morning to you.
Good morning to you guys.
How was the weekend?
It was good. I learned a new word this weekend.
Oh, excellent.
I've discovered if you don't wear a mask, you are a mask hole. And they already have T-shirts on the internet you can buy.
Nice.
Surprising.
That'll make people get along a lot better during all of this. That'll promote some nice warm feelings between fellow citizens.
Absolutely. But I thought, I can't wait. That'll probably be in the dictionary within a year.
I saw someone scold someone else over the weekend for wearing it around their chin and not over their nose, and called it a chin diaper.
Cute.
Yeah.
I think that's appropriate. But seriously, we are in trouble, as you guys can tell, in terms of this second wave of this pandemic.
Yeah, what are we looking at as far as the hospitalization situation goes?
It's becoming critical. Talking to my colleagues here across town, things are full. It's difficult to get people in and out of the hospital. They're dealing with, as you heard on the news, they say 2 or 3 times, I think it may be 4 or 5 times the number of COVID patients. And not only do the COVID patients require longer stays, typically sicker, they just require a lot more help, and they require a lot more equipment and those kind of things. So the concern is, yes, there is some availability of beds, but is there the staff to take care of them? And that's been the other problem that the hospitals are dealing with.
Yeah, that's one thing we talked about earlier this morning, Doctor, was, infection rates. We're seeing crazy numbers. I mean, I remember when, I think 12 or 13 was the trigger number for us to maybe get some more mandates put back on us. Now we're floating around 21. I saw up in Wisconsin, there's some 36% infection rates going on. It seems like those numbers have lost any meaning to people. And a lot of the messaging goes into that. Will this hospital bed situation, which we usually hear, the 10 to 14 day lapse between, a spike in cases to a spike in hospital beds, this next week, you expecting some bad stories about hospitals, and that maybe will change a couple minds out there?
I think so. With those kinds of rates and what we're seeing in terms of the spike of hospitalizations, I think we all agree the next couple of weeks are critical to see if we can finally reach kind of the peak and see some possibility that we're going to get on the downside. It's a big concern. I think we've talked in the past that the outpatient rates are interesting. They're important, but they really don't indicate the trouble we're in. It's the hospitalization rates. Once we exceed the hospital capacity, we're in a mess. If we can't get people in and take care of them in the hospital, then we're going to see our mortality rates start to go back up.
What do you foresee Thanksgiving, which comes up in 10 days? What do you see that doing to this entire mix?
It probably is not going to help. I think the recommendations for people to only have Thanksgiving with people already in their home is absolutely something that we need to do. We just need to stop the spread. And what I find interesting is the scientists are really struggling. I see there's an article in the Wall Street Journal talking about where we are getting these infections, and we just are finding we just don't know. It appears that a lot of them are coming through our homes, but we just don't know if that's true. Unfortunately, the contact tracing that we've been trying to do just hasn't been all that successful.
It sounds like, just taking, straw polls of people around here, that Thanksgiving is not going to be socially distanced for a lot of people. And where does the messaging get lost? How can we get people to follow the recommendation to do Thanksgiving, safely and responsibly this year?
I guess the only thing I can say out there is we are at capacity, I think, in terms of hospitalization in our own community. Just look at our own community. Don't look at, another state, another country. let's just look at what's going on here in Winnebago County. We've already heard about the high positivity rates. We know that translates into more hospitalizations. We've heard from administrators of local hospitals that things are becoming very critical. We need to stop this from getting any worse. So I don't know how we do any better than just implore people that we have to take care of our community. And if we don't do it responsibly as an individual, there are people in our community that are going to suffer.
And, you know, and you're right against the double threat of, we got the holidays approaching. As we mentioned, Thanksgiving's 10 days away. Christmas will be right around the corner before you blink, and New Year's rolled into that as well. And then you've got what is obviously a nationwide case of COVID fatigue going on.
Yeah, absolutely. The combination of the fatigue and the fact that the virus seems to be everywhere now. I know in the first wave, I had a few patients. I had a coworker that I knew had it. I didn't have any family members. I didn't have any close friends. Now that's all been turned around. I've had family member. I've had several friends of mine that have gone through it. It just seems like the virus is out there and it's everywhere.
Yeah, it seems to be nowhere to run right now from it, and it's affecting just every...
Absolutely, and we're kind of back where, again, from some of these studies, we don't know where really people are picking it up. We kind of assumed it as we shut things down. It wasn't so much the restaurants, the bars, the churches. People weren't going to meetings, but with the fatigue, people started getting out again. But I just think that the exposure is pretty much any place you can go, you could potentially be exposed.
Well, and it also kind of gives some teeth to the argument by the Restaurant Association as well, saying, you know, look, you're looking at all these new cases, but you're not tracing them back to people stopping into a restaurant or a bar at the same time. Well, we don't know exactly where we're tracing them back to, or if we're tracing at all. Right?
No, and we're not. We're just not able to do the tracing. Again, I'll refer back to this article that came out in the Wall Street Journal, and they're talking about different countries have been able to do some tracing, saying the small numbers have been linked to people that have been previously positive. But for more than 50% of the people that they're doing tracing on, they can't figure out where it came from.
So even countries doing tracing can't figure out where it's coming from?
Correct. The people that are doing the tracing, for instance, New York City, 10% were due to travel, 15% from gatherings, another 5% from institutional settings. Well, do the math, 80%, they couldn't figure out where the person got it.
Oh, that's troubling.
Yeah, that is troubling. And especially, I read a piece the other day that's saying at a place in Texas where 75% of the people who had recently tested positive and all that were mask wearers. Were those who had tried to abide by every bit of social distancing, every recommendation they'd gotten down the pike from the CDC or from their local health administration. They've tried to do it. It wasn't a bunch of people. Well, yeah, I'll admit I've been to a few parties and I was hitting the bars and all. 75% of the people that were admitted were saying I tried to do everything right.
Right, and it gets back to the fatigue. I know, like myself, you try to do everything right, but you might be doing something. You take your mask off. Maybe I work on the computer or something, and somebody comes up to me to say something, and I forget to put my mask on for 30 seconds, and I think, oh crap, I should have done that. It's hard to be 100% compliant, and we know the mask is not 100%, unfortunately, but it's the best we have, and we need to do it, and we need to social distance. And we need not to be in gatherings of people that we're not normally around in our household as much as we can.
Taking a little step over into some better news category, Moderna says their COVID-19 vaccine was 94.5% effective in a preliminary analysis of a large late-stage clinical trial. So we got the similar shot from Pfizer last week, talking about theirs being at about the 94% effective rate. Now Moderna says theirs at 94.5%.
Yes, those two things are very encouraging news. With one caveat, the distribution of those two vaccines is going to be a little bit of a problem. As you guys may know, the Moderna vaccine needs to be kept at minus 20 degrees Celsius, and the Pfizer vaccine needs to be kept at minus 70 degrees Celsius. That is the kind of storage that we don't currently have for our usual vaccines. So it's going to take some real logistics to get that vaccine out to the public.
Yeah, what does that mean right now, especially for rural the population that maybe not close to this? Would driving a couple hours to get your vaccine, is that how you would see maybe this being rolled out?
Probably that's the way they're going to have to roll it out. I saw a little article that said the CDC is now recommending that these small hospitals try to buy these special cold storage freezers because you're going to need special equipment. So I think we're going to have to move people from rural areas into urban areas where they have cold storage to be able to do it. So it remains to be seen. I know that Pfizer is going to be working with, I think, the CVS and Walgreens, and I believe that's the way they're going to try to distribute their vaccine. In other words, have CVS and Walgreens have the cold storage and do it right there. Because the big concern is, yes, it's 95% effective if it's stored properly. And when you're dealing with those kind of temperatures, it's a big concern about handling and storage.
Moderna says this morning new stability data shows their vaccine is stable at refrigerator temperatures for 30 days, much longer than previously estimated 7 days. For longer-term storage, it can be kept in freezers, though Moderna says it does not need the special facilities required for the Pfizer vaccine.
Yes, I think that's encouraging, but I think the initial storage, I believe, is minus 20, but I think once it's shipped, then they've got that time period to work with. I think the Pfizer vaccine, they can put it into containers for, I think, 7 days on dry ice. So there is some flexibility. It doesn't have to stay in the special freezers the whole time. But still, you can imagine very rural areas, that's going to be very difficult.
Well, and the fact that it's a double dose, too. 2 doses of Moderna's vaccine are given 4 weeks apart. Pfizer's 2 doses are given over a 3-week span.
Right, and that's the other problem of compliance. Can people get both of the doses? We ran into this when the shingles vaccine first came out. You guys may remember a few years ago, it was very popular, and you were supposed to get your shot within 2 to 6 months. Well, a lot of patients couldn't get the 6-month shot because it just wasn't available.
So it sounds like we definitely at least need some adults in the room to organize the distribution of this vaccine.
Absolutely. The distribution is going to be critical for this vaccine, for any of the vaccines, but certainly these 2.
Then, one more topic is back to the schools. A lot of schools going all remote learning here for the holidays. The medical profession see this as the prudent move. I know a lot of it is not necessarily for the kids, but for the just schools being understaffed right now. And so the right move, and do you see that lasting, over Christmas? They're not going to get back till March. What do you guys think of that?
I think it's probably a good move to take a time out here with the peaking of the coronavirus and the fact that we know that people are going to be gathering. It's going to be a critical time, and kind of look at it after Christmas and see what makes sense. I really hope we're a little bit on the other side of this by the end of the year, but nobody knows.
And as far as, being on the other side of it, I back to the vaccines for a second. One of the scientists behind the experimental vaccine developed by BioNTech and Pfizer said they're confident this could have the transmission of the virus, resulting in a dramatic curb of its spread, saying if everything continues to go well, we'll start to deliver the vaccine end of this year, beginning of next. Goal is to deliver more than 300 million doses of vaccine until April of next year, which would allow us to already start making an impact. So distribution and storage stuff aside, once it does get rolled out, there seems to be very, very high level of hope here.
Well, absolutely. If we get 95% effectiveness, I mean, those are the kind of numbers that will stop the spread. As we've talked before, the whole herd immunity thing, generally if we can get to 70% or slightly less, slightly more for most viruses, that stops the spread. So it's very encouraging. Now we have to convince people to take the vaccine. As we talked about, that could be an issue.
So let's assume that one, we're going to convince people to take it, and two, we figure out a way to get it to people. Is this going to be a yearly thing to get your COVID vaccination, just like we get the flu shots, or are these vaccines going to be good for X amount of years?
Nobody knows that yet.
Okay.
We're going to have to follow the path of the virus and test people and see how long the antibodies last, and then see how long, or if people do get infected again in some period or some time period next year, like flu. I don't think anybody knows yet.
Yeah, a lot of question marks still floating around all of this stuff. But the one question mark you don't have is, as far as Thanksgiving goes, dial it back.
Absolutely. People, dial it back. Our community is struggling a little bit with hospitalizations and taking care of people. So please, wear your mask, social distance, be careful.
All right. Dr. Norem, as always, we appreciate the time. We appreciate the expertise. And if you're willing, we'd love to rejoin this all over again next Monday.
I'll see you guys next week.
We appreciate it.
Sounded excited.
Yeah, well, who wouldn't be?